Hysteroscopy refers to a procedure in which we put a camera inside the uterus. The uterus is like a room where the baby grows. So, in patients who are having difficulty getting pregnant, it is very important that the room is perfect so the embryo can implant easily. Hysteroscopic evaluation of the uterus helps us visualize polyps, fibroids, and adhesions, which can interfere with embryo implantation. Fibroids are benign tumors of the uterus. Fibroids arise from a single cell in the wall of the uterus, which multiplies to form a tumor. Fibroids can project inside the cavity of the uterus. We call them submucous fibroids. Some fibroids can stay within the wall of the uterus. We call them intramural fibroids. Some fibroids can project beyond the wall of the uterus and can cause pressure on the surrounding structures like the bowel and the bladder. We call them subserosal fibroids. When the fibroids are within the cavity of the uterus, they are called submucous fibroids. This type of fibroids can make it difficult for the embryo to implant. So patients trying to get pregnant will need these fibroids removed in order to improve the chances of pregnancy. When patients want to get pregnant, these fibroids have to be removed in their entirety. It's important because when the embryo comes into the uterine cavity, the size of the embryo is so small that even if a small part of the fibroid is left behind, it will get in the way of pregnancy. Our practice specializes in the removal of fibroids. We can remove large submucous fibroids in different locations in the uterus entirely through the vaginal approach. The patients can go home the same day after the procedure and can try for pregnancy in a few weeks.